Assalamu alaikum. We will discuss a simple topic and in the same time a very important topic, which is estimation of gestational age or estimation of the duration of pregnancy. We start with the common question: why gestational age estimation is important? Gestational age estimation is important because if we correctly estimate or calculate gestational age, we can prevent the fetal prematurity. That is to say, prematurity is a delivery before 37 weeks of gestation, as well as post-maturity after 42 weeks gestation. The second reason is optimizing antepartum fetal growth surveillance. That is to say, correlate the intrauterine fetal growth to the gestational age. This is essential for diagnosis of certain fetal growth problems, such as small for gestational age, intrauterine fetal growth restriction, and fetal macrosomia. The third cause, or the third reason why gestational age estimation is important, is optimization of timing of certain fetal tests. These fetal tests will be shown in the next slide. The fourth and last cause is optimization of the social circumstances of the pregnant woman and her family regarding traveling, works, and other social activities. This is the prenatal genetic testing of the American College of Obstetricians and Gynecologists, assigning the time to perform the antenatal fetal tests for fetal surveillance. The gestational age can be known by one of the following methods: history taking, known last normal menstrual period, known single coitus date, known date of embryo transfer in IVF, known date of quickening by the mother, known early ultrasound. These are all can be obtained from history taking by clinical examination, by manual examination error pregnancy, which is which is an act of the past, it is no more used in modern obstetrics. Fundal level estimation, Sims fundal height or distance, and abdominal girth and fetal tone. Imaging ultrasound is the best imaging method to calculate the gestational age. We start with the known last normal menstrual period. It is calculated in weeks using different methods. Nagel's formula, using when the first day of the last normal menstrual period is known. The expected date of delivery is calculated by adding 7 days to the days and 9 months to the month to obtain the last normal menstrual period. By calculating the expected date of delivery and subtracting the date of today from the expected date of delivery, we can calculate the gestational age. This is an example. If the woman informed you that the first day of the last normal menstrual period was 10th of September 2020, the expected date of delivery will be 10th September 2020 plus 7 days and 9 months. And so the expected date of delivery will be 17th of June 2021. Or by another method, 10th of September 2020 plus 7 days minus 3 months gives the same result, 17th of June 2021. The gestational age at the day of case taking can be calculated by subtracting the date of the day from the expected date of delivery, giving the gestational age today. Another method is by subtracting the last normal menstrual period from the date of the day, gives also the gestational age. The last normal menstrual period of our case is 10th of September 2020. The expected date of delivery is 17th of June 2021. Today, assuming that today is 17th of May 2021, the gestational age is calculated as follows: 17th of May 2021 minus 10th of September 2020 equals 9 months plus 7 days. That's to say 36 weeks. So the gestational age is 36 weeks. By the other method, by subtracting the expected date of delivery, date of the day from the expected date of delivery, the result is 30 days. These plus these 30 days equals 4 weeks plus 2 days. We subtract these remaining period, which are 4 weeks, from the expected date of delivery, which is 40 weeks. So the same result occurs. You should remember that 13 weeks equal 30 months. 3 months. 13 weeks equal 3 months. Full term is 40 weeks plus equals 9 months plus 1 week. The second method is non-single coitus. Expected date of delivery equals date of single coitus plus 265 days. The duration of pregnancy can be calculated from the expected date of delivery as before. Example: the husband was abroad. He came to Cairo as a transit on 20th of January 2021. Sexual relation occurred. The wife reported that she had missed 3 or 4 periods and she felt pregnant, confirmed by positive home pregnancy test. The expected date of delivery equals 20th of January 2021, which is the date of the single coitus, plus 65 days. The expected date of delivery is 14th of October 2021. The gestational age is calculated accordingly by subtracting the date of today from the expected date of delivery. The third method is known date of embryo transfer in IVF cases. Gestational age equals date of embryo transfer minus 7 days plus 9 months. Minus 7 days plus 9 months. Expected date of delivery equals the embryo transfer date minus 7 days plus 9 months. Example, date of embryo transfer was 20th of April 2021. So the expected date of delivery equals 20 of April 2021 minus 7 days. So it is 13 of January 2022 after adding 9 months. The gestational age can be calculated by subtracting the date of today from the date of expected date of delivery. Date of quickening. Knowing that the exact date of quickening, we know the last normal period approximately by subtracting 18 weeks in multipara or 20 weeks in primigravida from the date of today. Accordingly, the expected date of delivery and gestational age can be calculated. This is a rough estimation because it is subjective, not objective. Knowing an early ultrasound. If the patient has an ultrasound image early in pregnancy, in her current pregnancy, the expected date of delivery and gestational age can be easily known by correlating the gestational age recorded in the ultrasound to the dates of that ultrasound examination. The second group of evidences or methods to calculate the gestational age, the first of the second group is bimanual examination. It is a method, a historic method used in the past in the absence of ultrasound because it is more ultrasound is more accurate and more reliable. In this method, used for post-diagnosis of early pregnancy and termination of gestational age if the uterus is not filled abdominally. When the lower part of the uterus was filled empty and soft, while the upper part was enlarged due to presence of conceptus. This sign was known as Hager's sign. Sorry. The uterus with a size of an orange was reported to be 8 weeks pregnancy, while that of a size of a fetal head was reported as 12 weeks of pregnancy. These approximate figures are no longer used in obstetrics, in modern obstetrics. However, some gynecologists still use them for reporting uterine enlargement due to gynecologic cause, not pregnancy, not estimation of duration of pregnancy. This is a picture showing the how to perform bimanual examination in the early pregnancy condition. The lower segment, this is the lower uterine. This is the lower uterine segment here, is empty, and this is a globular upper segment containing the conceptus, and the same is here. This was called Hager's sign. Hager's sign. We come to the fundal level. Palpation of the uterus, of the uterine fundus by the ulnar border of the left hand, while the other hand is rectifying the uterus, if it is levoposed or dextroposed, centralizing the uterus. The fundal level is estimated that if the fundus is at the upper border of symphysis, it is 12 weeks gestational. If it is at the upper border of the umbilicus, it is 24 weeks gestation, and if it is at the cervical junction, it is 36 weeks gestation. And so we can calculate the gestational age by fundal level, and also it is a rough method. The third clinical method is the symphysis fundal height. Symphysis fundal height, the distance is measured by a tape from the symphysis pubis to the fundus uteri. From the 16th week to the 36th week, the weeks of gestation corresponds to the distance. That's to say, if the distance is 25 centimeters from the symphysis pubis to the fundus uteri, so the gestational age is 25 weeks, and so on. So we can say that the symphysis fundal height corresponds to the gestational age in weeks between week 16 to week 36. What are the criteria of the last normal menstrual period? The last normal menstrual period is characterized by it is regular, it is normal in all its characters, frequency and menstrual flow, preceded by 3 normal cycles, and not preceded by hormonal contraceptions. When the last normal menstrual period is unreliable, when it loses one of these 3 criteria of normality. What are the causes of uterus or fetus more than the period of amenorrhea? This may be due to increased uterine content as lycoramni, as polyhydramnios, or increased fetal size as macrosomia, or multiple pregnancy, multifetal gestation, or localized increase in the fetal size as fetal ascites or hydrocephalus, or it may be due to increase in the uterine wall as presence of fibroid, or it may be due to miscalculation. What are the causes of uterus or fetus smaller than the period of amenorrhea? The causes are the reverse of the causes of uterus larger than the period of amenorrhea. Abdominal girth and fetal tone. In cases where there is no known dates and the evaluation of the age is only clinical, the obstetrician should consider the abdominal girth and fetal tone ratio between the fetal tissue and fluid on palpation, as certain gestational age may make the fundus uteri at the same point on the mother's abdomen. For example, fundal level of 36 weeks and 38 weeks and 40 weeks are nearly the same point on the mother's abdomen. So the obstetrician clinical sense is important in such situation. The fetal tone is increased with age. So the fetal tone is increased in 38 weeks than 36 weeks. The fetal tissue is more abundant than the fluid, amniotic fluid, with the advance of gestational age. This is how to palpate for the fetal tone. Ultrasound fetal biometry. Not all the scans during pregnancy serve the same purpose. You should remember that. The accuracy of the scans differ with age. Early pregnancy scans are the most accurate for dating. Mid-trimester scans are used for anatomy assessment, fetal anatomy assessment. Third trimester scans may assess liquor volume, fetal weight accurately, but are useless for dating. Third trimester scans are useless for dating. Again, third trimester scans are useless for dating because in third trimester the standard deviation is about 2 to 3 weeks, and this is a large or a huge margin of error. It is crucial that the mother is questioned if a scan was done early in pregnancy. If so, she should be asked if the finding corresponds to the last menstrual period dates. In clinical practice, if the discrepancy between the menstrual and the ultrasound dates is less than 7 days, the last menstrual period dates should be employed as long as the periods are regular. If the discrepancy is more than the expected dates of delivery should be based on the ultrasonographic fetal biometry. Again, if the discrepancy between the regular last menstrual period and the ultrasound fetal biometry is less than 7 days, we depend on the last normal menstrual period. If the discrepancy is more than 7 days, we depend on the fetal biometry or ultrasound fetal biometry. Early pregnancy before 14 weeks, the crown rump length and mean gestational sac diameter are the accurate ultrasound fetal biometric measures. The crown rump length is the best measurement early in pregnancy, accurate up to 1 day. The standard deviation here is only 1 day. All mothers should have this measurement, and this picture shows how to measure the fetal crown rump length. Gestational sac diameter, and more accurately the mean gestational sac diameter, with a transvaginal ultrasound, a 2 to 3 millimeter gestational sac can usually be seen by the 5th week gestational from the last normal menstrual period. A yolk sac is usually seen by 6 menstrual weeks, or by the time the mean diameter of the gestational sac is 10 millimeter. Fetal pool with hard tones or pulsations is typically seen by the completion of 7th menstrual weeks. This is the left-sided ultrasound picture. A very early 3 millimeter mean diameter of intrauterine sac at 5-week post-menstrual or 5 menstrual weeks. And the right-handed ultrasound picture is yolk sac. The mean sac diameter of the gestational sac is 10.6 millimeter. The length and the anterior-posterior diameter of the gestational sac are measured on this sagittal image of this retroverted uterus. This is the yolk sac. And this is the yolk sac and the fetal pool. An early 7 millimeter fetal pool corresponding to 6 week plus 4 days menstrual age. This is the yolk sac, this ring shaped structure, the yolk sac. This is the gestational sac, and this is the lycra. This is the yolk sac, and this is the fetal pool. Second trimester and third trimester, head, femur, and abdomen. Head measurement, biparietal diameter, and head circumference. The biparietal diameter measurement before gestational week 20 weeks predict gestational age with an accuracy of plus or minus 7 to 11 days. The precision tolerance of biparietal diameter dimensions decreased during the third trimester. Again, third trimester scans are useless for dating. The head circumference is less affected than the biparietal diameter by the head shape and variation and the presentation of the fetal head. So, head circumference is preferred as a more valuable measurement in assessing the gestational age after 20th week gestation. This is how to measure the biparietal diameter. The picture is like that, this arrow, and we measure the biparietal diameter crossing the transverse line. This is a typical gain for the head to measure the biparietal diameter. The femur length measurement include the ossified portion of the diaphysis and metaphysis, like that. This is the femur length measurement. It has been identified that the accuracy of femur length in the prediction of gestational age is 2.8 weeks, nearly 3 weeks. With increasing the gestational age, the accuracy decreases more than that. Abdominal circumference is measured by the ellipse facility of ultrasound equipment with stomach bubble, and a short segment of the umbilical vein at the level of portal sinus visible. Abdominal circumference should not be used at all to determine the gestational age. However, it is one of the key dimensions to assess intrauterine growth restriction in fetal macrosomia. This is how to obtain the abdominal circumference. This is the stomach bubble, and this is the umbilical vein. We can conclude that we can obtain gestational age measurement by history, by examination, and confirm that by ultrasound scanning. Thank you very much.